Hello, my name is Brad Cost, and I'm the Chief Executive Officer of QVHSystems, a healthcare technology company that is working to help clinicians across the United States to use our technology to understand their patients and their needs in literally a snap. QVHSystems, Quality Value Healthcare. We have assembled partners and team members that are at the top of their fields with amazing lifelong careers, helping clinicians in a pro-advocacy way. When we first started QVH, our single goal was to help. We developed accountable care organizations that brought clinicians together, MIPS registries that help clinicians understand healthcare measures. We've recently developed tools that will take in millions and millions of patient and claims records to quickly organize information for UDS and HEDIS reporting, literally at the click of a mouse, anytime. We are organizing and analyzing data across facilities, regions, and states. We're looking at ways to truly help clinicians, administrators, and patients to understand the best way to manage their patient healthcare outcomes, to help administrators manage their facilities, and to help patients live the best life possible. And today, I am so proud to introduce our latest platform, a system that looks at patient information in a different way, a unique way that organizes information, a way that just may change the world, literally at the snap of your finger. Let me introduce that platform today, SnapHx. Let's open the tool now and take a look. And just so you know, for this demonstration, we're using de-identified but real patient data. This data includes claims data from the patient's health insurers, which allows you to see all of the healthcare encounters, not just those at your facility. Here you'll see in the opening screen, there's a search function that will allow you to find your patient quickly. This is attached to the patient directory so you can search all of the patients associated under the facility or a specific doctor. SnapHx lets you select the date range that you want to see, but the system is automatically going to default it to the most recent 12 months. Let's now find a patient and start looking at the various scenarios that we have. Let's start by entering the patient, Jacob Logan. See how quickly the patient comes up with the autocomplete function? You can see that we've divided SnapHx into 4 separate sections. Let's look at each one of those sections. The first section, Gap Watch, reveals the patient's demographics, the quality measure gaps, and critical social determinants of health. At a glance, you can see Jacob's age, his advanced directive status, and who his primary care practitioner is. You'll also see the quality measures that need to be addressed. We've set it up so that a measure that must be reassessed at each visit, SnapHx will display a P or an F to indicate the prior result. You can quickly export this to-do list and use it for the visit, or you can send a message with that information to the appropriate staff member that then will complete that specific task. Below that, you'll see displayed icons that shows that Jacob is a veteran who is living alone, which will place him at an increased health risk. We now can see a quick understanding of Jacob's health status by looking at SnapWatch, this second section. Here we see key biological indicators including BMI, blood pressure, and A1C values. as well as whether any of them are in a cautionary or an alarm state on the chart. If we want to focus on one specific measure, you can simply click on the blood pressure, the BMI, or the A1C button. We see that Jacob's most recently systolic value is now being controlled at 120. You can also see a holistic picture of Jacob's contacts with the healthcare system. Below the chart, you're going to see these icons that reflect significant services. Encounters that indicate profound issues such as hospitalization, SNF stays, home health care, or hospice. They are indicated by color-coded shading that reflects the duration and the type of care. You'll see this at the legend below the section. You can also get information on his office visits by clicking on the red circle above each month. You'll see a summary of the number of significant encounters that Jacob has had, including his office visits. We can in turn then look at that summary by clicking and turning it off by simply clicking on the summary button, thus providing more room for SnapWatch display. Let's move to the third section that we call the significant health problem history. It's true that most EHRs provide some type of a problem list, but SnapHx displays not only the patient's diagnoses, but also the encounters associated with those diagnoses. As you can see, this timeline view provides a holistic picture of the patient's health status and their treatment status. Let's now look at the encounter information. Each encounter is displayed in the role of significant problems in which it is associated. This display quickly identifies those problems with frequent encounters and those serious events such as hospitalization. We've color-coded these encounters with a different color associated with each individual clinician responsible for that specific healthcare visit. The patient's primary care encounter is displayed as a gold star so you can quickly recognize it. We've taken ER visits and made them quickly identifiable as a red square, and then we've taken lab tests and indicated those with a triangle. The type and the amount of resources that are needed to support the patient's care are quite evident here. The color coding of the encounters supports patient care coordination, quickly highlighting the fragmented care that can occur. You can actually hover over any dot. We see that all the information is available from the data sources about the encounter, including the rendering practitioner's name and the services that they provided. For information on hospitalizations, SNF stays, home health, or hospice, simply hover over the eye below the vertical line, which marks the start of that encounter. We can see that Jacob had an inpatient stay in October and soon after received home health services. Our final section is the medication, which we call MedWatch. As with the other SnapHx displays, this list does more than a typical EHR. It includes information from all of the data sources, not just the facility. It also displays the fill status information when it's available, showing when and where the medication was last filled, thus allowing the practitioner to monitor all of the medication compliance. And finally, the medication list. We built it dynamic so it can be sorted by medication name, the prescription date, and who the clinician that filled the prescription was. The SnapHx display is quite unique, and you'll see at a glance that the clinician has a holistic understanding of the patient's health and their health care. This information includes all of the encounters the patient has had inside and outside of the practice. This makes it possible just in a minute or so that the clinician knows the health problems affecting the patient and can quickly determine which conditions are being successfully monitored and managed and which need further attention. Now that I've shown you basically how SnapHx works, Let's look at various other patients to see how it displays those different types of conditions. Let's enter patient Samantha Henderson. If you look at SnapHx views for a typical type of patients, you'll find that many of your patients have few health problems and will look somewhat like this. But quickly look at gap watch and you'll see that Samantha is high risk with a history of abuse, incarceration, housing, and employment types of issues. But a quick look at SnapWatch shows that her BMI, her blood pressure are both in the healthy range. If you scroll down and look at significant problems list, you'll note that there's a health maintenance type of row which shows encounters that are preventive or related to health maintenance. This patient has documented yearly annual wellness visits, and SnapHx identifies gaps in preventive care visits. Let's look at patient Zachary Smith. Here again, you'll see that SnapWatch and the significant problem history tell the patient's story sort of at a glance. We will see that the patient's diabetes is not controlled. However, you will also see that Zachary is meeting regularly with his primary care physician, who is clearly in charge of this patient's care management. In seconds, the practitioner is reassured that there's no surprise health encounters and understands the state of the patient health problems. Let's now look at a few more complex types of patient. Our Chief Medical Officer has identified unique SnapHx benefits. Let's look at patient Stephanie Hernandez. SnapHx is invaluable for consultants and others with no previous knowledge of the patient, as it provides a quick understanding of a patient's prior health care history. If you look at the significant problem history, it shows that Stephanie's hypertension, coronary artery disease, and atrial fib appear well controlled and being actively monitored. However, the clinician is quickly drawn to the hospice indicator. A quick look at the prior visit indicating abnormal vaginal bleeding tells a sad story. Overnight, Stephanie's health picture changed dramatically when she learned of her fatal cancer. You will see that the care for her pressure ulcers shows that Stephanie is essentially bedridden. The clinician can now anticipate and prepare Stephanie for her mental state to deal with the cancer. Let's now look at a very complex patient. Let's enter patient David Warner. The significant problems are consolidated into more general categories. This is indicated when there is a caret, an expander caret on the right-hand side. In order to display all of the patient's specific diagnosis, click on that caret and you will see the expanded display. This expanded view of the significant problem history shows all significant problems that are displayed at the most specific diagnosis on one scrolling screen. It'll also allow you to see the procedures associated with each one of those problems. In this case, you'll see a complex patient with several chronic conditions. You'll see a typical presentation for a patient with underlying hypertension and hypercholesterolemia, which has progressed to heart and kidney disease. Atrial fib and chronic kidney disease stand out as the conditions requiring most of the attention, having many more encounters. If you'll examine the significant health problems for chronic kidney disease, you'll see that the encounters show many visits for therapeutic injections, suggesting a standard care. You'll see the atrial fib visits are frequent and not regularly spaced, indicating that the condition may not be stable. But quickly you can see that the clinician is armed with a firm understanding of this patient's health and knows where to focus the time for this patient. SnapHx collects and displays the entirety of the patient's health care encounters organized in a way to show activity in each of the significant problems. Comparing a stable significant problem with those that have many encounters provides a focus, it improves time management, and ultimately the understanding of resource intensity that the patient may need. It can be easy to miss a significant health event for a patient with multiple complex chronic type conditions. Let's enter the patient Deborah Smith. Here, the conspicuous indicator for a hospital stay in May draws your attention to a new condition with upper GI bleeding and esophageal varices, as indicated by the green circle on the esophageal varices diagnostic line. Note that this is the first time there is any encounter for this diagnosis. This new condition is not lost among the multiple encounters related to the patient's otherwise dominant issues, including advanced or aggressive breast cancer, diabetes, and kidney disease. You can also easily see both the institutional service and the hospitalization and the associated professional services. Let's look at our final complex patient. Let's enter patient Devin Stewart. Here you'll see another complex patient with hypertension, high cholesterol, pressure ulcers, and a stroke. In seconds, you can see the picture that is painted, a history of stroke, chronic conditions that are stable and controlled, and a life, most recently, that's dominated by prostate cancer treatment, which appears to be in the follow-up stage. Let's now go to the other end of the spectrum and look at some very young or new patients. You'll see when we enter Catherine Andrade, there won't be a significant history to review, and that'll be true with most babies. However, it is still important to make sure that babies are receiving all the care that they need. SnapHx provides a quick list of those outstanding vaccines, but Catherine appears to be a healthy child receiving the appropriate follow-up visits. Looking at patient Jeffrey Simpson, we see that like babies, most children will not have a long problem list, but SnapHx is a robust tool that still provides value. By displaying quality measure gaps and any social determinants of health, SnapHx provides the clinician with valuable context for these rarely seen patients. Here, we know at a glance that Jeffrey needs his BMI percentile calculated and also dental sealants. We know that Jeffrey comes from a low-income family and is exposed to secondhand smoke and has problems at school. We know that making a tool with the amazing abilities that SnapHx has at the snap of your fingers must be that available quickly, so we have developed SnapHx for your mobile devices. You have just seen our revolutionary patent-pending health history tool, SnapHx. This novel view, a way of seeing the patient's significant health problems associated with their medical encounters, then viewed as a timeline, can quickly help clinicians understand which issues are most pressing and require the most attention. Additionally, GapWatch, SnapWatch, and MedWatch make the tool clinically invaluable, even for patients that don't have significant health problems. And finally, SnapHx provides both administrative and clinical efficiency. For the administration, SnapHx dramatically reduces the time, the effort, and expense required to compile a patient's comprehensive health and current health status. For clinicians, SnapHx enables the combining of these multiple data points into a holistic, actionable clinical picture at a glance. Together, these efficiencies maximize the resources and the time SnapHx users have available to devote to the patient. Thank you today for your time. I hope that you will agree with us that SnapHx will truly help your profession, your network, and your association to change the world.